Okay, so for this slide, before I end class on the next slide with some statistics I want you to think about involving things like gender and eating disorders and age and eating disorders, I want to talk some about the physiological consequences of eating disorders, particularly anorexia and bulimia. Unfortunately, in those pro eating disorder websites and other forms of social media that I mentioned at the beginning of this lecture, there is this perception, this message that these eating disorder behaviors are not harmful to the body and are simply a lifestyle choice, and that unfortunately is not the case. And so part of that psychoeducation that I told you is involved in treatment for eating disorders helps people to understand the physiological detrimental consequences of the behavioral eating patterns and disordered eating that they're engaging in. And so I want to talk to you a little bit about that today because it is important as part of our health psych class for you to understand how these psychological and behavioral manifestations do in fact impact the health of the body and potentially why they result in early mortality for some, unfortunately. So let's talk about the physiological effects of anorexia and bulimia. One, what we call electrolytic imbalances. These are, electrolytes are essentially charged particles that influence the transmission of impulses across your neurons. And inside and outside of our cells, we have a certain concentration of these so-called electrolytes, like calcium and potassium and sodium. Without getting too complicated for the nature of this class and this lecture, the balance of those charged particles inside and outside your cells is very important for how your neurons transmit impulses and therefore lead to chemical release and various important processes of the body. When you dysregulate the balance of those charged particles, those electrolytes, you can actually create circumstances in which you dysregulate the functioning of various organs of your body, particularly, for example, your heart. Electrolytic imbalances can lead to heart attack, cardiac arrhythmias like irregular heartbeat that can lead to heart attack or other cardiac problems. Electrolytic imbalance can also create dehydration, which itself creates cardiac and other organ shutdown. Hypotension is another detrimental side effect of eating disordered patterns. So hypo, under, hyper is too much, hypo is not enough. Hypotension means your blood pressure drops to a dangerously low level. And this happens because the low body temperature, the dehydration, and the malnutrition collectively are lowering your blood pressure. And if your blood pressure is high, that's not good. But if it's too low, that is also dangerous and can lead to irregular heartbeat and heart attack. Malnutrition. Okay. Malnutrition can be caused by undereating or overeating. What does this actually mean? You've probably heard the term malnutrition a million times. What does it really mean? It means that there is a deficiency in the body for energy, protein, and what we call micronutrients. So vitamins, for example, vitamin A, iron, iodine. And malnutrition can mean all of these things in combination or any single one of them is happening. When you are lacking these key energy elements, proteins, nutrients, micronutrients, and macronutrients, you will develop severe health risks. And among these health risks, and this is by no means comprehensive, but things like respiratory infections, kidney failure, blindness, heart attack, lack of nutrition also can lead to, for women, what is referred to as amenorrhea, which is a failure to menstruate after a person has already begun to do so, or an irregular menstrual cycle. And the reason for this is when somebody is depriving herself of enough nutrition, and particularly fats, you're not able to store estrogen. You need fat in your body to store estrogen. If you deplete too much fat because you're not intaking enough fat, or you're not intaking enough fluids in the body, or you're restricting excessively your carbohydrate, sugar intake, and fat, that can lead to lack of estrogen being stored, and you need estrogen to menstruate. And so oftentimes women who drop below a dangerously low weight in their anorexia symptomology will stop menstruating even though they've already begun to menstruate. In addition to that, the malnutrition can lead to, again, kidney failure, heart failure, seizures, brain damage, okay? In addition to that, people experience slowed metabolism. And this is what I was saying before in the prior slide when I was talking about psychoeducation, or not the prior slide, but a few slides back, when I was talking about psychoeducation for people with anorexia and bulimia and their cognitive distortions about how to most effectively lose weight. Your metabolic rate, as I said on that point in the lecture, your metabolic rate will slow down if you are restricting your caloric intake for all the reasons I said on that prior slide, because it knows it's not going to get enough nutrition regularly. So it holds on to that caloric intake and slowly burns it to make sure homeostatic process can at least attempt to continue for as long as possible before malnutrition sets in. Dehydration and muscle atrophy, right? So dehydration, I mentioned before, if you're not taking in enough nutrients or fluids, and that creates electrolytic imbalance and organ shutdown. In addition, muscle atrophy. In other words, your muscles begin to waste. Sometimes this is known as muscle wasting. Your muscles begin to literally decompose, to waste away. People will show a decrease in muscle mass because your body begins to feed off of itself, right? So eventually, if you're not giving it enough nutrition, your body will start to attack its own, right, inner workings to try to feed itself, and your muscles will begin to degrade because your body will try to use your muscles for some way to maintain homeostasis. Anemia is also a common outcome of eating disorders where your blood has an insufficient number of red blood cells, and that's very dangerous because you need your blood cells to transmit oxygen, right? So hemoglobin is in your red blood cells. Hemoglobin is the iron-rich protein. That's what gives it its red color, hemoglobin. We need that protein in the hemoglobin to carry oxygen from your lungs to the rest of your body. And if you are anemic, you're not carrying enough oxygen to the organs of your body, which will, guess what, cause your organs to shut down. In addition to that, eating disorders have been shown to result in actual skeletal damage and poor bone growth or osteoporosis. There are people who developed eating disorders when their bodies were still developing in early adolescence, and they never actually developed to the appropriate full way that they would have if they hadn't had the eating disorder, because they actually disrupted their skeletal growth as a result of their malnutrition and their disordered eating patterns. The lack of calcium causes a thinning of the bones. It causes a reduction in bone mass because of a depletion of calcium from insufficient intake, insufficient protein in your bones, and that makes people predisposed to fractures. In addition to that, something known as Lanugo. So Lanugo happens when people start to have a kind of downy fuzz, patches of downy fuzz on the backs of their arms, on the side of their face and neck. This happens frequently in people with anorexia, especially, although it can happen in bulimia too. The reason for this soft hair that grows on the arms and neck and part of the chest and face of people with anorexia is because a couple of things. Your body has a protective mechanism in it to try to keep you warm during periods of starvation and malnutrition. So as people with anorexia are literally starving themselves of nutrition, the body grows this hair to try to maintain body temperature. In addition to that, the restriction of fat intake will lead to hormonal imbalances. I mentioned to you things like estrogen, for example, and those hormonal imbalances also can create the growth of this hair on the arms and face and chest and neck. I didn't mean to skip the one before that on the slide. Permanent reproductive system damage is common in people with anorexia and bulimia. Again, because of hormonal shifting that is taking place as a result of these disordered intakes of important proteins and fats and carbohydrates that we need for the reproductive system to properly grow and to get oxygen as well. In addition to that, we have the corrosion of dental enamel, especially in people who are bulimic, because when they purge, there are various forms that purge takes, and one of them is, as I mentioned in a prior slide, self-induced vomiting. Well, as you know, if you've ever had episodes of throwing up from an illness or otherwise, when you throw up, what's happening is your stomach acids are coming through. And if you are purposefully purging through self-induced vomiting, you're repeatedly causing stomach acids to come through into your mouth, and it eventually erodes the dental enamel and breaks down your dental enamel. You can lose teeth. In addition to that, people with bulimia will often show enlarged salivary glands, which is why they start to get a puffy appearance around their face and the bottom of their face, around their neck where the glands are. The reason for this is that your body is an amazing machine, and it is dynamic. So when things happen to throw it off of its homeostatic process and threaten its survival, your body changes to try to accommodate those new situations and protect itself so that it can stay alive and still remain homeostatically appropriate. And so what happens here is when people with bulimia are showing the enlarged glands and the facial puffiness, it's your body's natural defense mechanism. It's trying to counter the damage created by the constant attack from your stomach acids. And so like hydrochloric acid, which is constantly being brought up through self-induced vomiting. This is an onslaught or irritation that the body then tries to accommodate that. And in doing so, it's trying to prevent immunological decline. And though those swelling glands are an example of your body's immune system trying to fight this damage to the body. In addition to that, the frequent vomiting is teaching your body that it's not going to be able to keep its nutrition. So the glands, the salivary glands, enlarge to more effectively take in and break down food for the body's use, because it knows you're not going to keep it very long. And so, digestion starts in your mouth with your saliva. And so the body learns, it's an amazing thing, but the body learns, oh, you're going to throw this up again because you do this all the time. So we're going to become more efficient at beginning to digest it the moment it gets into the salivary area. And that's another reason the salivary glands enlarge, to be more efficient in beginning digestion, to keep the foods that you're going to throw up and use it for homeostatic processes. Esophageal disorders that can be deadly, by the way. GERD, gastroesophageal reflux disorder, cancer of the esophagus. All of this is a result of self-induced vomiting. When you constantly purposefully force yourself to vomit, you're bringing acid up through the esophagus. And eventually, I have gastroesophageal reflux disorder. I've had it since I was a kid. The reason we medicate it is constant acids coming up through the esophagus begins to break down the esophageal tissue. And in doing that, it causes mutation of the tissue, which is a cancer risk. If you're constantly inducing vomiting and causing acids to come through the esophagus, that mutates your tissues. And that can lead to disorders of the esophagus, including cancers. You can also rupture your esophagus and bleed to death. Extremely dangerous. In addition to that, gastrointestinal bleeding. So in your intestines, you're actually starting to bleed again from repeat acid flow through those intestinal walls. And stomach erosion. People begin to bleed literally in their stomach lining and in their intestinal tract. They can tear perforations. A perforation is a tear. They can actually tear holes into their stomach lining and their intestines. This is all from the self-induced vomiting that is bringing stomach acids through, and the abuse of diuretics and laxatives, forcing yourself to go to the bathroom when your body is not ready to do that. There's a reason you don't do that all day long. There's a reason that diarrhea, if it continued indefinitely, would be dangerous. Dry skin, dry hair, and nails, brittle nails and hair loss, all from vitamin and mineral deficiencies. That's the malnutrition created by these disordered eating patterns, and dehydration. Immunosuppression. You know what immunosuppression is. We talked about this in a variety of contexts throughout the semester. Some studies in medical journals indicate that the most common cause of immunosuppression, so you're immune. I got another new word. Am I up to 5, guys? The common cause of immune system malfunctioning appears to be malnutrition, because you need proteins to make antibodies. And if you can't make antibodies, you cannot fight viruses, bacteria, and mutated tissues, which, as you guys know, put you at risk. Immunosuppression puts you at risk for a multitude of heart-related cancers, gastrointestinal, sugar regulation, and other types of disorders. Finally, blood sugar problems and insulin deficiencies. The liver and the kidneys start to malfunction from malnutrition and also the abuse of diuretics and laxatives, and that leads to problems with properly regulating sugar, which can lead to either hypoglycemia, which is not enough sugar in your blood for energy, or it can lead to hyperglycemia and eventually diabetes, where you have too much sugar in your blood and not enough insulin to remove those sugars effectively. So, I really hope you take seriously, if you know somebody who you believe has an eating disorder of the type I've talked about in today's class. If you yourself are concerned that you might have disordered eating patterns, I want you to recognize that these are serious, not just from a psychological perspective, but from a physiological perspective. The danger that these patterns create and potentially early death is very real. And so educate, these pro-eating disorder social media avenues. Educate as much as you can the people in your lives who may be engaging in disordered eating patterns that could put them at risk. Do your best to educate them as to what the actual side effects are physiologically and why it can hasten their death. Not to end on a terrible note before we move on to our final slide of the class, but I want you to take very seriously why this is more than just a psychological problem. It creates very serious physiological consequences. I will see you on our last video, except for class business.